Thank you, Bob and Bob. I will tell you, I'm old enough to remember hearing that, but I don't remember hearing it. I guess I was a young teenager back then, and maybe had I heard that, I would have gotten involved with Planned Parenthood even earlier than I did. So thank you for that. That was really powerful. Thank you, Roland, for your beautiful pieces. Thank you, Betsy, for inviting me to do this. I am very, very honored to speak to you today. You know, sometimes I'll hear from people, you're preaching to the choir, you know. Well, yeah, I am. I've done a lot of singing, actually. Don't get me started. I might do that today. And I sang with choirs. And, you know, through the choir, we find our voice. We find our harmony. So I like doing that. Some of the issues I'll talk to you about today are very divisive, obviously. I hope that you're here to take it in and hear more about what you believe in. And I make it a point not to speak to organizations who aren't believers. So thank you. And I'm big on water, so let me just pour some of that on. The threat of the new administration looms very large on so many levels. Our democracy, our national security, the economy, the environment, access to reproductive health care, certainly, and the safety and dignity of people of color, the LGBT communities, and so many issues that are critical to the safety and well-being of people living in the United States. Today I'm going to have to narrow that field, and I just want to warn you I'm easily distracted, but that's why I wrote notes so I wouldn't start rambling about all of these topics that I mentioned. But we're going to talk about reproductive health care and the threats to reproductive rights. And I'm going to talk to you about Planned Parenthood and the urgent need for the services that we provide, the threat to those from the administration, and certainly the threats not just to the president himself and his advisors, but through appointments of extremists and their attempts to exclude Planned Parenthood from the healthcare safety net, what we call the healthcare safety net. How we're fighting back, and how you can join us. And I have to remember to say this always, Planned Parenthood is a bipartisan organization. We would love to be able to support Republicans who are with us. Unfortunately, you know, I've been with Planned Parenthood for 35 years now, and Republican candidates that are with us have dwindled. So we do our electoral work nationally through Planned Parenthood Action Fund and statewide through Planned Parenthood Advocates. So I'm going to be mixing some of our, what we call our 501c3 work, our nonprofit work, also with our electoral work. For 100 years now, we just celebrated our 100th anniversary last October. Planned Parenthood has been one of the leading providers of high quality and also critically affordable health care for women, men, and young people. We now have 650 health centers. There's one located, at least one located in every state in the country. We're also the nation's leading provider of sexuality education. 1 in 5 women will receive care at one of our health centers in their lifetime. Annually, we help prevent 579,000 unintended pregnancies and also 197,000 abortions. We have local partners in 12 different countries that serve more than 1 million every year. Our website sees 60 million hits every single year. That's a lot. 75% of Planned Parenthood patients live on incomes of 150% of the poverty level, the federal poverty level, which means it's about, for a family of 4, it's about $35,000 in income a year. Every year we do 600, and I have to look at these, 360 breast exams, 270,000, did I say 1,000 before I meant to, pap smears, 72,000 cancer screenings, 4.2 million tests for sexually transmitted infections. 930,000 emergency contraception doses are distributed, and we do education and outreach to 1.5 million. What we have now is an urgent need for our services. Without Planned Parenthood health centers, many would not have timely access to the care that they need. And I say timely access because we've got this down at Planned Parenthood. At most of our health centers, you don't have to wait longer than 2 days to get in. All of them offer walk-in appointments. You might have to wait a long time, but you will be seen. We're open weekends, we're open nights, and more than 1/2 of Planned Parenthood health centers are in what we call health provider shortage areas, and those are rural and medically underserved areas. So Planned Parenthood provides care to those who otherwise would not or would have nowhere else to turn. And we often provide preventive services that other safety net healthcare providers don't offer. For many of our patients, we're their only entry into the healthcare system. So many of our patients say that you're the only doctor or nurse I see all year. Thank goodness you're here. But unfortunately, policymakers across the country disregard the very real need in their communities and continue what I call their myopic campaign to shut us down. Blocking access to Planned Parenthood health centers would have a disproportionate impact on communities of color. Inequity in healthcare access is linked to factors like income and barriers like ability to pay and having the time to go to a provider. Women's lives are complicated, and we shouldn't forget that. Our policymakers have also been on a campaign to target minorities. It's thinly veiled, but 24 states now have passed really senseless legislation and regulations that have threatened more than 300,000 Black and Latinos access to care at Planned Parenthood health centers. Reproductive rights are at stake, and there's absolutely no denying that. The president, I hate to even say his name or even think of him as the president, just by the way, I'm on fire. How many people are here are on fire? Yeah, okay, because you seem like a really calm group. What do you think? I'm glad to hear. You know, after the election, we had a Planned Parenthood national gathering. It was in early December. We were planned to be celebrating there. It took a different tone, but what were we saying to each other instead of asking, "How are you?" because that was difficult to answer. It was, "Great to see you!" And also, I'm on fire. And I say, welcome to the dawn of the fighting man majority. Betsy asked me to say a few personal things about myself. I consider myself an optimist. On election night, I was in Center City at a hotel with about 400 other people in the room. And I'm still running around at 10:45 at night screaming, "There's a path! We still have a path!" You know, somebody said to my husband, "You need to take her home." There's an Emily Dickinson quote that says, "Hope is the thing with feathers that perches in the soul and sings the tune without the words and never stops at all." Hope is a wonderful thing. You have to back that with action as well. And I think that's what we're doing, and that's why you're here, too. Our president said on the campaign trail that he wants to overturn Roe versus Wade. He suddenly became, quote-unquote, pro-life. He ensured that his nominees for the Supreme Court would be pro-life. And he also said at one time, I'm sure you remember, that women should be punished for having abortions, you know, his unprepared, off-the-cuff remarks. So where I really believe that Donald Trump, I said his name, doesn't really have any center, but when it comes to Planned Parenthood and reproductive rights, Mike Pence is the real deal. He's been on a one-man crusade against Planned Parenthood and reproductive health for a decade at least. He was the first member of Congress to introduce federal legislation to specifically defund Planned Parenthood. And he sponsored 6 measures to shut us down. In 2011, Pence, Mike Pence, yeah. In 2011, he spearheaded an effort to defund us in Congress that almost led to a government shutdown. You probably remember that. And after a groundswell of outrage, Republican leadership abandoned the efforts. He's had the most extreme positions on abortion access. He said, "I long for the day when Roe versus Wade is consigned to the ash heap of history where it belongs." When he was governor of Indiana, he signed into law 8 abortion restrictions, putting his politics, as always, ahead of science and medicine, even when Indiana was facing an unprecedented HIV epidemic. One provision of a bill that he introduced in Indiana was so extreme that several really, really conservative and anti-choice Republicans in Indiana even objected to it. Among other things, it would have required abortion providers to bury or hold funeral services for fetuses. So when the response to, and I hear this all the time, people will say, well, it would be great if we could get Trump impeached. Oh, but then we have Mike Pence, right? I hear that all the time. But what I have to say is, if I just focus on Planned Parenthood, Pence is running all this stuff against Planned Parenthood anyway. And our president is just going to, because of Pence's loyalty, allow him to do that. So in that regard, we have him anyway. I won't say any more about that because I'll ramble again. During the Republican primary campaign, because of the president's confusing stances, many saw him as distinct from the conservatives that they mistrusted. So it helped to reconcile his supporters to them. Voters didn't really see him as dangerous on social issues they cared about. Planned Parenthood held focus groups right after the election. They were held in 4 cities. And we invited Planned Parenthood supporters who also voted for Trump. And it was interesting because they knew very little about the social conservatives of those who surround Trump. A 54-year-old in Phoenix, Arizona, after hearing about Mike Pence, said, "I'm astounded. I guess I've been living in a bubble. He sounds like a tyrant on these issues." There was a woman in Harrisburg, actually several women in Harrisburg, when they were told about Trump's views on this, and certainly Pence's, and that he was going to try to overturn Roe and defund Planned Parenthood. They said, "What? We didn't vote for him to do that." It's pretty frustrating to hear it. Another said, "Should the government defund Planned Parenthood? I probably wouldn't vote Republican again for a very long time because they're out of touch with reality. If we're still fighting over women's rights in 4 years, this country needs a revolution." Well, I say, how about now? American people do not want and did not vote to see their health care stripped away. Okay, repealing and replacing the Affordable Care Act has proven to be a very much trickier task than the GOP leadership anticipated. Through the Affordable Care Act, many states expanded their Medicaid programs, and repeal of Medicaid expansion would cause 1.1 million people just in Pennsylvania to lose their health insurance. With the repeal of the Affordable Care Act, or ACA, would go the birth control benefit. This has saved American women $1.8 billion since it went into effect. 55 million women across the country would lose access to this birth control benefit, which means there's no copay for services, for birth control, for screenings for sexually transmitted diseases, for breast exams and pap smears. Also, being a woman could once again be a pre-existing condition. LGBTQ, especially transgenders, would disproportionately suffer. The ACA prohibits discrimination based on gender identity. And, the transgender community faces many barriers to care. I'm proud to say that next month at Planned Parenthood Southeastern Pennsylvania, we will be starting to provide services to the transgender community. Our staff, our supporters just feel wonderful about that. If Congress defunds Planned Parenthood and shuts down health centers, really they would cause a national health care disaster. The reckless threat to defund Planned Parenthood, which really means preventing anybody who's on Medicaid from using their Medicaid insurance at Planned Parenthoods because we would not be able to bill and get reimbursed. So it's not Congress saving money by cutting Planned Parenthood from the budget. Defunding, the word defunding, the term defunding Planned Parenthood is a little bit misleading. It's the federal government telling people where they can and can't get health care. Paul Ryan makes claims that healthcare experts call ludicrous because when he says the community health centers could absorb Planned Parenthood's patients. It's not true, especially in rural areas or medically underserved. And many of these community health care providers on the list that he refers to don't even do family planning. Some of them are dentist's office. So that's not where you want to go. So it's alarming to see that he and his colleagues continue to blindly dismiss healthcare experts at the cost of Americans' well-being. Defunding Planned Parenthood is an attack on the patients that we see, those who rely on us for family planning, birth control, etc. This is what kills me. I know you've thought of this many, many times. It defies logic. It defies logic to be opposed to abortion, but block access to birth control. So what's this really all about? Birth control, family planning is the frontline defense against abortion. It makes no sense. We have protesters in front of our building. I've been walking through them, for 35 years now, and I never really get used to it. I learned Sylvia here is a patient escort. I could never do that. It requires a certain amount of temperance not to engage with these people. And her job is to get people our patients and our staff and anybody who visits into the building safely without any commotion. But so many of them, and I would say this, from the protesters to Congress, really are there. They're motivated by misogyny. I know, I've been here a long time, and it really does come down to that. Some of them are deeply, deeply religious, and they do believe that there's no difference between an embryo and those of us here in this room. And I would say, okay, that's not why most of them are protesting. That's not why most of them are against our services. It's about keeping women oppressed, keeping women from achieving their life goals, because if you can't control your fertility, you can't really excel and succeed in this society. So, blocking access to birth control, what's that about? It's bad health policy, it's bad political policy, and it's also bad fiscal policy. For every public dollar spent on family planning services, more than $7 is saved. It would cost taxpayers $130 million a year due to an increase in unintended pregnancies. So defunding Planned Parenthood is not going to be a popular move. 65% of all voters and almost 50% of Trump's voters oppose stripping reimbursements from Planned Parenthood. Almost 50% of Trump voters. We say at Planned Parenthood, to fund us at your peril, there's going to be a big disabling and divisive fight. The global gag rule. By reinstating and expanding this, now this flip-flops between administrations. This administration put politics over women's lives. This is going to cause clinic closures around the world, resulting in more unintended pregnancies and unsafe abortions. Not only did they, I can't think of the word, but put the global gag rule back into commission, but they expanded it beyond family planning. So it means overseas that programs that address HIV and AIDS, maternal and child health, and Zika response efforts will now be effective, setting back years of gains and undercutting health access for millions. There's a program, the National Family Program called Title X, and right before Obama left office, the administration finalized a rule protecting access to basic reproductive health services for the 4 million across the country who receive care through the National Family Program. 1.5 million of those receive that care at Planned Parenthood. This program was started by who? Do you know? What administration? The Nixon administration. So, the last week, the House voted to overturn Obama's rule that protected access to Title X. And what's notable is that many Republicans listened to their constituents and voted against it. 85% of people who are in the National Family Planning Program have incomes below $23,000 a year. Still, politicians in 14 states have voted to block public funds from Planned Parenthood because we perform abortions, even though those services are completely separate from family planning services. Believe me, we are separately audited. We keep them completely separate. We have, as far as some of Trump's cabinet picks, I'm going to stick to the ones that would affect reproductive health. There's Tom Price, who's now leading HHS. The fear of the administration and appointments like Tom Price is why Planned Parenthood has seen an increase in our online appointments and really seriously patients flocking to get to us for birth control. There's been a 900% increase in what we call long-acting reversible birth control, like IUDs or implants. We had a patient come into our lobby at 12th and Locust the day after the election and said, I need an IUD, Trump is president. Funny, but hey, what are people hearing? The abortion ban ran recently in Pennsylvania. I'll talk to you about that in a bit. But patients called that day. I have an abortion appointment this week. Can I still get in? So our work's been cut out for us. We have to get these messages out. But Tom Price is against taking that no copay birth control away from the 55 million women through the ACA. And he's opposed to abortion. He consistently demonstrates he's out of touch with women's lives. Jeff Sessions, our Attorney General, has a long record of attacking women's access to health care and abortion. He has extreme views on civil rights, voting rights, immigration. He opposed multiple efforts to address fair pay. He also voted against reauthorizing the Violence Against Women Act. Supreme Court nominations. It's never been more important than it is right now. But it's the second nomination to the Supreme Court. If we get through a very conservative judge, we're going to be back to where we were with Scalia. It's that second vacancy. So we just have to give Ruth Bader Ginsburg her vitamins. And she runs on piss and vinegar, so I think she will. So it's clear from the events of the last few weeks, the courts will be the last and sometimes the only line of defense against dangerous and unconstitutional attacks on our basic rights. And the president promised that he would appoint Supreme Court justices who would overturn Roe v. Wade, and nominee Judge Gorsuch has a terrible record on women's health rulings. And he sided with politicians trying to deny women and men access to basic health care. He sided with Hobby Lobby, do you remember that, in 2013, stating that bosses should be able to deny their employees insurance to cover birth control. And he recently wanted to cut Planned Parenthood patients off of preventive care in Utah. So when we have a president who threatens key principles like religious liberty and a Republican leadership in Congress hoping to deny health care, it's clear that Judge Gorsuch is not up to the task of serving on the nation's highest bench. I consider him a wolf in sheep's clothing. I consider him a polite version of Scalia. Maybe he's a virgin too. Support for access to safe legal abortion is at a record high. Nearly 70% of Americans don't want to see Roe versus Wade overturned. That's the highest rate since the case was decided in 1973. And like I said, oh no, that was birth control. Also, 50% of Trump supporters don't want to see Roe overturned. Individual rights and freedom really go to the heart of who we are as a country, and that includes access to safe legal abortion. The majority of women in this country now, this is going to make most of you feel old, were born after Roe was decided. For many of them, the legal right to control their bodies is taken for granted, and that's a good thing, and it's something they've known their entire lives. Threatening those rights would have the greatest impact on those who still face barriers to health care. Young people, women of color, those in rural areas, people with low incomes. People simply don't believe that politicians or judges should be making decisions about their bodies, about when and whether to become pregnant, no medical decisions, no interference. So rather than relitigate Roe versus Wade, we should work together to build on the enormous progress that we've made in expanding access to birth control and reproductive freedom. Let me just say something about Pat Toomey. Just as anybody go to Tuesdays with Toomey?
Yes.
Yay! Hopefully you're wearing those pussy hats when you wear it. And by the way, men can wear pussy hats. Yes. No shame. It's a badge of honor. You're Betsy.
I was hot. Yeah.
Pat Toomey has built his career on attacking women's basic right to health care. He's got a 0% voting record on issues that are important to Planned Parenthood. He wants to ban abortion, basically, and he said there should be penalties for physicians who perform abortions. You go to the state of Pennsylvania, not national, the state legislature. They just passed one of the most restrictive abortion bans in the Senate. It will go to the House in March. Governor Wolf will veto it. He has promised us, he has said it in public over and over again. His veto-proof margin is very, very, the opposite of what I'm saying. He's got a margin that's very thin. We began to shift the balance with the election of Governor Wolf, but due to redistricting and gerrymandering in Pennsylvania, both chambers of our legislature remain hostile to women's health. 2 years ago, just 2 years ago, Pennsylvania legislature spent a third of its time on bills to ban abortion. I am not exaggerating. And there are ongoing rumors of attempts to defund Planned Parenthood. So Governor Wolf needs us in 2018. Now that the plan of the National Administration is clear, Planned Parenthood, Federation of America, and the Planned Parenthood Action Fund have launched a campaign called I Stand with Planned Parenthood. We are in the middle of a movement moment. The momentum of the resistance is growing. I say join it for whatever causes that you support. It's the only thing that's going to keep us sane and hopefully safe. We've tapped into the anxiety and energy to turn it into action, and we have to turn out everybody we can to use it in the fight ahead. Our work is going to call on us to engage and build power, young people and communities of color like never before. We've built one of the toughest and one of the largest political forces in the country. It was 8 million before the election, Planned Parenthood's, and now it's 10 million. Our brand is strong. If you're not on our side, expect a tough fight. We have 10 million supporters, and it's going to keep growing. We're ready to defend health care with everything we've got. And the volunteers and activists for Planned Parenthood through January and through the end of March will be holding 300 events in 47 states and 150 cities, really intending to mobilize supporters to fight back against this attacks. Marches, rallies, organizing events, and more. How many people have felt so inspired by these town hall meetings? Just amazing. A congressman, I think it was King in Maine, said, "Angry town halls trivialize our democracy." I think we know where our democracy is being trivialized. And Hillary Clinton said the other day, if you can't take the heat, get out of Congress. What's a little of concern to me a bit is Democrats are now worried about holding town halls too. I think they're worried about that they're not resisting enough. And for many of them, that's true. So I think they need to hold their town halls and see that we expect them to resist more. I stand with Planned Parenthood's campaign goal, as I said, was to turn the energy into motivation. We're in this for the long haul. This is a marathon and not a sprint. Yeah, we're all going to get tired. My husband and I said, we go dark on Saturdays. We just don't listen to anything. It's really hard, too. I don't check my emails. We figure, somebody's going to text me if they need me. We don't listen to the news. But by Saturday night, we cave and we start screaming again. But, our health is important. We've got to stay strong. And so we take a break and have others take over. This is a marathon and not a sprint. Every inch of progress we make matters. Check out istandwithpp.org. It will direct you to take action, sending letters to members of Congress, volunteering for Planned Parenthood, sharing your story, finding an event, or calling your elected officials. Planned Parenthood is going to continue to work to ensure that everyone, including the 2.5 million that we serve every year, has access to the basic health care they depend on, no matter what. And since November 9th, we've seen, as I said, an unprecedented outpouring of support. And let me just give you an example. Just at Planned Parenthood, Southeastern Pennsylvania alone, the week prior to the election, we had 6 volunteer applications completed online. The week after, it was 140. That was a big jump. And prior to the election, 4 donations were made online. After the election, the week after, 600 donations were made online. There was a national campaign that we didn't even start. Make a donation. Planned Parenthood had nothing to do with it. Planned Parenthood in honor of Mike Pence, right? Which is great. We did that with George Bush too, but it was independent organization. So anyway, 300,000 separate donations in honor of Mike Pence have been made. It's a testament to the steadfast commitment of Planned Parenthood supporters. It's clear that this is a reflection of the fact that reproductive rights and health care were absolutely on the ballot in this election, and people are determined to stand up and fight back. Resistance matters. How can you get involved? Well, you can volunteer. You can donate. You can speak out against hate. You can visit PlannedParenthoodAction.org. Make an appointment for health care. We will see anybody, no matter your age. Sign up for our emails and texts. I have lots of handouts that I'll bring to our next session or what's it called? They talk back. I love the talk back. It's important to show up and speak out. How many people went to the March in Washington? That's the birth of a movement. How about Philadelphia? Great. I'll tell you, I was ready to go to Washington. I'm going to confess, I really wanted to be there, but every time I thought of getting there, but we had it figured out. And then they asked me to speak in Philadelphia, and it was such an honor to be able to speak. And just to stand up on that stage and see 50,000 people, that was a fact, 50,000 people was just tremendously inspiring. We have built lasting power that's going to persist no matter who's in office. The outcome of this election is not the sum of our story. The symbolism of who we represent goes beyond the boundaries of our programs and our services. We fight for human decency and basic human rights. And I know those are principles that the Ethical Society is also founded on. I have seen, I will speak for myself, the despair I felt in the few days following the election have disappeared. You know, still scared. We should also always be scared. It helps motivate and our resistance. The despair is gone. The United States has the strongest civil society in the world. Our resistance matters. Charles Blow is somebody that writes for the New York Times. I read him faithfully, nodding your head. Love him, right? Yes. He said, he wrote a column maybe a week or two ago about disruption. Be disruptive. Disruption is not a dirty word. In this environment, it's a badge of honor. So, thank you. Keep up the fight. Resist, disrupt, and thank you for standing strong with Planned Parenthood. Okay, good. I'm going to sit down and shut up now. Elizabeth Warren.
Thank you, Dayle. I hope you will join us following our coffee and conversation, probably around 1:15 in the Collier Room, and we can continue the conversation. At this time, the Ethical Society relies on contributions from its friends and members. Our hosts today, Arnold Fishman and Gemma Fishman, will come forward to accept your donations. And also, I want to mention that the plate today, the cash plate, is being split between the Ethical Society and Planned Parenthood.
So dig deep.